and we have literally right now all of the lines open so that you can have any questions you may have answered today. Next slide, please. Next slide. Okay, here we go. This slide shows the vision, mission, priorities, and values as set forth by our Governor Pete Ricketts. These are the standards by which all state staff are tasked to conduct themselves in doing the state's business. Next slide. We have some housekeeping items, and because we are rather nervous about muting you from our side so that we don't cut you off anymore, we really need to ask you to keep your phones muted from your side to reduce background noise. And then we will ask you to use either the chat box or the raise hand icon to let us know that you want to speak, and we will call your name. And then you can unmute from your side and ask your question. So again, the two ways to let us know that you have a question is to click on the raise hand icon, which is to the side of your screen, or to enter your question in the chat box. This webinar is being recorded, and it will be posted on our website and will be available as a resource on our library page. And should you think of something that was spoken of during the webinar, or you think of a question after the webinar, don't hesitate to contact us at dhhs.ehrincentives@nebraska.gov. Next slide, please. The presenters today are myself, Diane Rolfsmeyer. I'm a program specialist with the EHR Incentive Program, and my colleague, Karen Moran, who is also a program specialist with the EHR program, and we are being assisted by the program's assistant, Lavana Moslander. Next slide, please. As we go through answering questions, and we've collected some questions that we have seen come to our website that we will also be bringing forward, we wanted to provide you with resources. The ones you're seeing, the references you're seeing on this slide are really the source documents that we will refer you to for the various questions that come forward, and we will highlight which reference pertains. And we're going to leave this slide up for the duration of the question and answer sessions so that we can point out the reference for your future use. So with that, since all the lines are open from our side, is there anyone who would like to ask a question to open out the session? Hearing none, or not seeing any in the chat box, as I said, Karen has put together, we have people who bring forward their questions to our email address, and we've collected some that we have been seeing as we go through this attestation period. However, we do have a listener, Ron, who has posed the questions, do you foresee any changes for 2018? You want to answer his question, Karen?
Sure. So for program year 2018, which will be the next attestation year that providers will be attesting for, I think program year 17 and program year 18 requirements are very similar. I haven't done a deep dive into all of the requirements for program year 18 yet, but I do know that CMS is trying to streamline the program a little bit, and you know, like next year people can still attest to stage 2 instead of having to attest to stage 3, and that's actually one of the questions that we'll get to here in our presentation.
Okay, so to kind of get this started going, and again, if you have, as you're listening to the questions we've collected and the answers, if you want to expand with your own questions, don't hesitate to either type it in or click on the raised hand icon. What are the specific measures for meaningful use and quality measures for providers and hospitals for program year 17?
Well, for providers, there's 10 meaningful use measures and 6 clinical quality measures for stage 2, and clinical quality measures don't need to be in specific domains anymore. If you refer to the CMS specification sheet for meaningful use measures, depending on either stage 2 or stage 3, that will help to answer a lot of your questions. And hospitals have different measures than providers do. On this reference page here, the first bullet point talks about program year 17 CMS references, and that link, the website there will take you to the specification sheets. And when we get questions to the EHR mailbox about the program, we refer back to CMS's specification sheets a lot. It goes into detail about the measures. It cites the final rule references in there, and so we refer back a lot to that and wanted to provide you with the same information that we have.
Okay, Carrie, we see that you have sent in a question. If we did not qualify for 2017 attestation to Medicaid, would we qualify for Medicaid in 2018 for either our CA and or providers?
Okay, well, it looks like the question is regarding either providers or hospitals. And providers can skip years. As long as you're in the program now, providers can skip years. So if you didn't qualify for program year 17, you still have a chance to attest for program year 18. But hospitals have to attest in subsequent years. And so you have to attest this year in order to come back next year if you have any payment years remaining.
Was there any follow-up question, Carrie, from you on that?
This is Carrie. Can you hear me?
Yes,
yeah,
we can.
Okay. Well, the thing is, we had attested way back in 2015 for the 90 days for stage 2 mods when those first came out. That they said if you do this for the 90 days, you don't have to do it for the full year. So that was in 2015. So in 2016, for our call, we didn't think we needed to attest because we had already done that. Well, hindsight, we were supposed to for the full year. It's what we were told later on. So we received a hardship for 2016, and then when I asked this year for 2017, I was told that the call could not attest because we didn't attest in 2016. And there was payment left.
Carrie, do you mind if I ask which hospital you're calling about?
Oh, no, that's fine. It's West Holt Memorial Hospital.
Okay, thank you.
And I believed I talked to or emailed Karen.
Yeah, this is Karen. Thanks, Carrie.
Yeah.
There was some confusion about the final rule and some clarification, and we had just received clarification from CMS about the final rule that hospitals, unless they had gotten a payment for program year 2016, they were no longer eligible to receive any additional payments. And we posted a provider bulletin about this back in December, you know, as soon as the rule was clarified, and, you know, we dug into it a little bit more. We posted a provider bulletin about it, but yeah, unfortunately that is the case. Even if a hospital took a hardship, CMS says that it can't issue a payment. We still can't issue a payment even if a hospital took a hardship for that year.
Okay, that's fine. I want to make sure that, I just want to know for future references if there's, if we need to or we should go ahead and try to attest for Medicaid for the upcoming years. I know that 2017, if I understood right, we're not supposed to. And then I'm just wondering when 2018 is finished and reporting period opens in 2019 for the 2018, if we should try to attest.
Right. I don't think so, Carrie, because it has to be in subsequent years now too. Is
right.
part of the rule. So
now, is that just for our call, or is that also for providers?
That's for hospitals. Just for hospitals, it has to be subsequent. The same rule applies to everybody across the board, where you had to have gotten into the program by 2016, which we did in a sense, but yeah. Yeah. And unfortunately, yeah, it's hospitals that are affected, and you know, we wish it were different.
Okay, I just didn't want to miss something, so we don't need to worry about Medicaid then for our providers or our call.
No, just for your hospital, Carrie. I'm sorry, it's kind of confusing. Just for your hospital, but your providers, if you've got some providers connected to your clinic, like a clinic in West Holt, or
right.
The providers can still attest as long as they got in with program year 16. As long as they had started participating by then, they could still attest, but the hospital is not eligible to.
Okay. Thank you.
I would like to ask again that since we are relying on all of you to keep communications open, we're getting some feedback on the sound. Please mute your lines during the presentation, and either hit the raise hand icon or type in that you have a question, and then unmute yourself at that point. So we're going to go along our list of questions that have come into our mailbox. So Karen, can you specify what the specific measures for meaningful use and quality measures for providers and hospitals are for program year 18?
Sure. So for program year 18, for providers, there's 10 meaningful use measures again, and 6 clinical quality measures for stage 2. Clinical quality measures, again, don't need to be in specific domains anymore. And just like with program year 17, I would refer you to the CMS specification sheets for meaningful use measures for either stage 3 or stage 3, depending on what you will be attesting to. And again, hospitals have some different measures, so be sure to look at that as well. The second bullet down will go into the second bullet down on this reference page will give information regarding program year 18 in the specification sheets. And once you look at those, if you have questions about them, certainly reach out to us and let us know. We, like I said, we refer to the specification sheets a lot and find them particularly helpful.
Thank you. Another one we have seen off and on is that this came from a provider. Only 2 providers in a group can meet MU, and all 4 providers in the group can meet the patient volume requirements. Can we only submit for 2 providers instead of 4? In other words, do all providers in the group have to pass MU and pass the 30% encounters in order to attest?
Patient volume can be done via group reporting, but meaningful use reporting has to be done per provider. So the whole group can meet the patient volume requirements because maybe 1 or 2 providers in the group meet the patient volume threshold, but the meaningful use requirements, each provider alone has to be able to meet the meaningful use requirements. So in this case, the 2 providers that didn't meet the meaningful use but did meet the patient volume would not be eligible to attest.
What is the MU and CQM reporting periods for program year 17? And also, what are the MU and CQM reporting periods timeframes for program year 18?
Well, for program year 2017, the meaningful use in clinical quality measures is 90 days for providers. For program year 18, the meaningful use is 90 days, and the clinical quality measures is 365 days. Except if it happens to be your first time attesting to meaningful use, then it would be 90 days instead for the clinical quality measures. It's important to note that the meaningful use periods and the patient volume reporting periods are different time frames that the attestation will be asking for, and they can be different reporting periods. They don't have to coincide with each other. The patient volume reporting period has to be 90 days. The meaningful use reporting period has to be 90 days at a minimum, but it can be more than that. Anything above 90 days is fine, but 90 days at a minimum, and the same with the clinical quality measures. It has to be 90 days at a minimum for program year 17, but it could be more than that. And if you note the 3rd bullet down on the reference page, this goes into clinical quality measure reporting requirements for 17 and 18 from CMS. So that would give more information.
Just pausing here for a moment to see if anybody had any follow-up questions on that. These can be complicated answers, so I want to make sure everyone feels comfortable in any follow-up that they want to do. Okay, next question. What type of report do I need to collect for our physicians in order to submit for Medicaid attestation?
Well, when you attest, when your providers attest, something that the attestation will ask for is that you attach your report from your electronic health record for meaningful use and clinical quality measures.
Okay. When is the patient volume reporting period time frame?
The patient volume reporting period is 90 days, and it can go back 12 months from your attestation. So if your attestation gets submitted in April of 2018, this month, let's say, it can go back 12 months. So you can look back all the way back to April 2017 as a starting time frame for your 90 days patient volume. It can't go any further back than that. When you go to attest, the system will stop you and say, you'll get a message that says you're not choosing a patient volume reporting time frame within the last 12 months.
If all 4 providers in a group met or exceeded the 30% Medicaid encounter threshold, would it be more efficient to attest as a group or individual for patient volume?
Well, the general answer is generally group. It just tends to be easier. Then you don't, as an office or clinic, you don't have to find multiple patient volume reporting periods. But typically, providers attest as they have in the past. So if they've attested to individual previously, it tends to make the most sense for their clinic that they keep attesting individually, or vice versa for patient volume or for group reporting. But this isn't always the case, and we're happy to look at your individual scenario on a case-by-case basis. So if you have questions about that, if you should do individual or group reporting, just send us an email.
How many years of the program can providers participate in, and can a new provider start now?
Providers can participate in 6 years, and hospitals can participate in up to 3 years. You had to have started in the program by calendar year 2016, and you know, like I mentioned earlier, the hospitals now have to participate consecutively. Providers don't have to participate consecutively at this point, but the program does end in 2021, so as long as you're eligible, you want to keep attesting each year to get the maximum number of payments that you can.
Can I report to MIPS and the Medicaid EHR incentive program as a provider?
Yes, the CMS's MIPS program and the Nebraska Medicaid EHR incentive program are two different programs. You can attest to them at the same time. This is kind of confusing because when the Medicare EHR incentive program was still active, the Medicare program through CMS, you could not participate in both Medicare and Medicaid EHR incentive programs at the same time. And we actually have a MIPS reference on our reference page here on the slide that goes into a little more detail about what's the difference between MIPS and the Medicaid EHR incentive program. How do I know if I participate in one or both of them? So be sure to check that out.
For EHs, do we need to attest with Medicare before we can start attestation process with EHHS?
No, you do not need to attest with Medicare first. However, CMS does approve or disapproves, but hopefully approves the hospital's meaningful use measures. So until that's done, we can't issue our payment. But be sure to attest with us, though, anyways, so that we can determine things like patient volume, some of the basic eligibility requirements. As soon as CMS approves of your meaningful use measures as a hospital, that information will come to our system, and if everything looks okay with the eligibility side, too, then we should be able to issue payment after that.
Speaking of eligibility requirements, what are the eligibility requirements for testing?
Well, that's a good question. There's a number of them. On our slide deck here on this reference page, we have the second to last bullet says the Nebraska Medicaid EHR Incentive Program website with the FAQ page. And our FAQ page goes into detail about what some of the eligibility requirements are for providers. And I've got the list here, so I can just go ahead and read those. You need to have seen patients covered by Nebraska Medicaid. You need to meet the appropriate patient volume threshold. For eligible providers, you can't be hospital-based. You need to meet practitioner licensing requirements for the type of eligible professional that you are in the state. You can't have any sanctions. You must demonstrate that during the program year you used your EHR technology in a meaningful way, a meaningful use way. For hospitals, we have to have the data on your Medicaid discharges, total discharges, inpatient days, total Medicaid inpatient days, total inpatient days, the hospital's total charges and charity care charges. And most commonly, we get this information from the hospital's Medicare cost report. And physician assistants, in order to be eligible for the Medicaid EHR incentive program, need to practice in either a federally qualified health center or a rural health center that is led by a physician assistant.
When is the EHR incentive program supposed to end?
Well, like I mentioned earlier, the program is supposed to sunset in 2021.
Okay. How can I find my CMS registration number to retrieve my user ID password for the Nebraska EHR Incentive Program portal?
The CMS registration number is the number that was received after you completed your registration as a provider or a hospital at the CMS registration and attestation website. And if you've forgotten or lost this number, you'll need to contact the CMS help desk. And it's important to note that we don't, as the state, have that number. If you want to contact the CMS registration and attestation site, you can, we posted the website out there that you can get the phone number off of.
And the last question that we have put together that we have received through this attestation season in our email box is, what is the reimbursement for Medicaid providers?
For Medicaid providers, it's since everybody should be done with their first year by now, all of the subsequent years, and there's a total of 6 years that payment can be received for, it's $8,500 unless you're a pediatrician and your Medicaid patient volume threshold is between 20 and 30%, then you're eligible to receive $5,667. And like I said, you can receive up to 6 total payments.
So with that, we'd like to pause for a moment and see if anyone has thought of any questions as we were speaking, have any questions or desire some clarification for any of the questions that we have brought forward, have any specifics about your experience, attestation experience that you need to share, comments for the greater good.
Yes. Can a new provider, we have a couple of providers that have only been with our facility for a year or two. Can they now start the attestation process with Nebraska Medicaid?
Well, it depends. If they were in another state and had started in the program with 2016, then they should still be eligible. They had to have already started in the program, even if that was another state, and maybe they're new to Nebraska only, that's okay. But if they, if they aren't new to Nebraska and have not started in the program prior to this program year, then they can't participate.
That is also to say, this is Diane, that if these are a couple of providers that came from elsewhere and they started a testing as far back as 2012 and for whatever reason did not continue in the attestation sequence, they can come back and attest, just as long as they have entered the program in no later than 2016. Is that helpful?
Yes, that answered my question. Thank you.
Okay. We have a question from Ron. Didn't it used to be that PAs were ineligible for this program? NPs have always been able to attest, correct?
This is Karen. Well, as long as I've been in this program, and I've been here for about 4 years, and it's my understanding that now PAs are eligible and that they have been eligible. The caveat is with PAs is that, and this isn't for any of our other providers that are an eligible provider type, but they have to be leading a federally qualified health center or a rural health center. And nurse practitioners are eligible. Yep.
Any other questions? And again, as as I had said earlier, if you're ruminating a question and we close this webinar before you have finalized it, please do not hesitate to email that question to you. As we went through the question list, you could tell that we get questions all the time in our mailbox, and we are happy to clarify any question you may have. And that email address again is dhhs.ehrincentives@nebraska.gov.
And this is Karen. If anyone wants a copy of this reference list, we're sure happy to send that out. Just shoot us an email to the EHR mailbox, and we'd be happy to get that information to you. And there's our email address listed on this last page here.
So we're not seeing any more questions come in, so we're going to start closing out the webinar, and there's still time for you to write a question in if you're thinking about that. We certainly want to thank you for your time and your attention, and in most particular, your patience with our technical difficulties. We're glad that you came back and that you asked the questions that you did ask, and we hope that this has been helpful. And as Karen said, our email address is up on the screen, and as well as our phone number and our website address. And all of these are available as a resource to you in the process of attestation with Nebraska Medicaid EHR Incentive Program. So with that, and seeing no more questions coming on the screen, we're going to wish you the very best of the remainder of your day, and we hope this has been helpful. And this concludes the webinar.